I am Bukola Adedeji. I'm a certified bra fitter from the FabFit Academy US. I'm the founder of the Bra Girl. It's a brand that improves the quality of life of women by removing hassles from ill-fitting bras. I always like to say that I'm a dressmaker by expertise, so I know how a dress should fit. And I'm a banker by experience. I know that buying one bra that fits is much better than buying 10 that don't. Economy scale, or what they call it now. So yeah. And so that's what we do. We just help women live their best lives by reason of the bras that they wear. And yes, there is a direct connection between the support you get from your bras and your overall well-being as a woman. And this is why we initiated the TheBraTalk. I initiated this in the year 2018 to help women navigate this overwhelming journey of finding the right bra for every phase of life they're in. You can explore TheBraGirl.com for more information about the brand. But right now, in commemorating the Breast Cancer Awareness Month, it was just fitting that we should create more awareness around this disease from different perspectives. Now, one perspective is coming from a medical doctor today on how to be proactive about our health for prevention and how to manage post-diagnosis. And another perspective is coming from is somebody who has actually survived the disease and is here to tell us the story. Okay, and now she only has not come back to tell us her story, but now she's providing support for women that are going through, that are going through this disease right now and giving them support at various levels. So I'm so excited to have her on board. Our first speaker is a young, vibrant, and energetic woman. She was diagnosed with breast cancer at the age of 36, that's even below 40. 9 years ago. She obediently followed her doctor's treatment and recommendations while seeking God's mercy through the process. And now she's standing as a survivor. Mrs. Ojo is a woman of many parts. She's actively involved in breast cancer advocacy programs under the auspices of LP Sapphire Foundation, a not-for-profit organization she founded with the aim of giving hope to victims of this disease and their loved ones. She and Asikiya Lamina, a fellow survivor, both run the foundation and they organize several breast cancer-related activities. And they also volunteer as counselors for newly diagnosed patients at Rivers State University Teaching Hospital in Rivers State. LP Sapphire Foundation has so far assisted over 200 women who were or are victims of breast cancer. Mrs. Dayo Ojo is also a successful entrepreneur who deals in the event industry as a professional foods and drinks caterer. She's married to Mr. Omo Ojo, and the union is blessed with 2 beautiful daughters. Now, the first thing that she told me when I first started the discussion with her was, don't even be scared of calling that word breast cancer. Don't even fear it, And I remember telling her in one of our conversations that you've just got to fight that battle for us, and you're here to give us the victory. Breast cancer doesn't have to be a death sentence. That for me was a very strong aha moment, something I cannot easily forget, because for fighting, for staying, for getting healed, for coming back to tell your story, you have just won a battle for many, many women. We can say, oh no, this doesn't have to be the end of me. And that's why I'm so, so excited that she's just coming to share her story with us today. Okay, so sharing her experience with us, and she's gone through and she's come back to say, never, never fear. So please post your questions in the chat box and she will answer afterwards. Thank you, Mrs. Ojo, for being with us today. I will now take a virtual step back and welcome Mrs. Dayo Ojo.
Much, Bukola, for having me today. Good evening, ladies and gentlemen. I'm sure we have some gentlemen on board today. The topic about breast cancer does not only affect women, it affects all of us. It touches all of us, male, female, everybody. So you're all welcome on board. I want to specially thank Mrs. Bukola, the Bra Girl, for making this possible, for putting this together. She has put in a lot of work, and I really salute her. Her attention to details is next to none. Thank you so much. I hope and pray that at the end of today, somebody's life would have been touched. Somebody somewhere would have learned something new that can be shared with another person just to save a life, right? If what we do here today saves just one life, that is good enough. But I'm hoping it will save even more. So thank you everybody for tuning in, and thank you the Bra Girl for putting this together. I really appreciate. As already introduced, my name is Dayo Ojo. I'm a breast cancer survivor. I'm a 9-year breast cancer survivor. I work with another breast cancer survivor to run a foundation called LP Sapphire Foundation. Her name is Asike Alamina, and she is a 15-year breast cancer survivor. So you can see that a lot of people survive this disease, right? Apart from both of us, we now are privileged to deal with many women who are either passing through or have passed through breast cancer. So we talk to a lot of women within our vicinity or even outside our current location. So breast cancer touches all of us. You will all agree with me that you would have known somebody somewhere whose sister or mother or daughter or wife, somebody who has had to suffer trauma because of breast cancer. And so it's a topic we cannot shy away from. We have to talk about it. Unfortunately, I was a victim, and thankfully, I survived, and I'm still surviving by the grace of God. So I'm here today basically to share my story, and I'll do that in a bit. But before I go ahead, I want to encourage you all to get pen and paper so that as I talk to you, you would put down your questions and probably type it in the text box so that at the end of my presentation, your questions can be answered. Please take notes. No question is foolish. No question is too hard to be asked. Ask me anything. I will be very happy to answer you. Okay? So that's where I'd like to start from. Today, I'll be telling my story under the umbrella of several subtopics. I will tell you about my diagnosis. I will tell you about my treatment and the side effects that I suffered. I will tell you about the support that I got while going through that journey. I would also tell you about the medical facilities that were available to me. I will tell you about the finance, what is required, maybe not necessarily in my own case, but generally with respect to how breast cancer is being treated here in Nigeria. And then I will tell you the importance or the important role that spirituality plays in going through this journey. I would also share with you my life after. Okay? Now, when I'm done telling you about all of that, I will tell you a bit about the statistics that we have for breast cancer. And I'll tell you a little bit about LP Sapphire Foundation, which is a foundation that I founded just so that I can support women who are victims, not just women, patients who are victims of this disease, whether male or female. So I start by telling you about my diagnosis. I was taking a bath one morning, and I just remembered that radio jingle that says, early detection is the key to surviving it. I don't know why that jingle, flashed in my mind that morning. Well, I decided while taking a bath to examine my breasts. You know how they say it's important for a woman to know her breasts. So I started to examine my breasts. Of a truth, I had never done that before. And so I didn't know what to do. I didn't know what I was looking for. I honestly didn't know what I was checking for, but I did it anyway. Somehow, in palpating my breast with my fingers, I felt something in one of my breasts that I didn't feel in the other. I was like, okay. I told my husband about it. I asked him to examine it for me. He did. And he said, yes, there's something in one of your breasts, so you may need to see a doctor as soon as possible. Because I had never been a sickly person, it didn't bother me. See, going to the doctors was not something I was afraid of. So I happily went to the doctor and told myself that, well, whatever it is, they'll just take it out and I'll be okay. I went to the doctors. The doctor examined me and they did a biopsy. They had to take out the lump they were feeling. I was told at the time that I had a generally lumpy breast, a breast condition called fibrocystic breast disease. I'm told a lot of women have that breast condition, so it's nothing to worry about. However, they took out some breast lumps from my breast and did a biopsy. Unfortunately for me, it looked like because I had a generally lumpy breast, they had taken out the wrong lumps that were not the lumps that were not malignant. And so when my biopsy results came back, the results suggested that the growth was benign and I had nothing to worry about. However, because I had a breast condition called the fibrocystic breast disease, I was told that the condition has to do with me having cysts and fluid in that breast. And so, if I feel some heaviness at any point in time, I should feel free to come back so that they can suction the fluid and I'll be all right. So, I went back home happy and I moved on with my life. And after a while, I started to observe some changes. Remember, at the beginning, when I examined my breast, I wasn't sick. I had no pain. I had no discharges. I had nothing. Nothing was wrong with me. I had no sick feelings whatsoever. So at this point, I was told that the growth was benign. Well, that's what I expected anyway, so I moved on. But I kept observing that breast and I realized that the breast started to change. It got a little bit bigger and then it got a bit harder. At this point, I thought to myself, this must be changes due to the fibrocystic breast condition that I was told about. However, I didn't just assume. About 6 months after that original biopsy, I decided to go back to the doctors so they can do another check and to complain of what I was observing. This time around, the doctor said, oh, wow, you will need to do a sonomammogram. I said, what does that mean? He said it is another form of investigation for the breast. So I went ahead and I did it. And after I did the sonomammogram, I was told that I needed to now come back for another biopsy. This time, they were not going to do a lumpectomy because remember, I had a generally lumpy breast. So this time, they told me they were going to do what they call a quadrantectomy. And that means that they were taking a quarter of my breast off for pathology. So I did that. And sadly, the result came back saying that I had a malignant growth. Wow. And that's where my story began. I was given my diagnosis on the 23rd of September 2011. That is 9 years ago. And I was given that diagnosis on a Friday in the company of my dear husband. Of course, both of us were devastated because we didn't see that coming. We never expected it and it hit us like a huge blow. Well, the doctors told me, Madam, it is not a death sentence. Luckily for me, on that particular day when I was giving my diagnosis, there was a woman around who had gone through this experience and the doctor just called on her. He knew she was around in the clinic about that time. So he called on her and she came to talk to me. She said to me, I've been through this. Don't worry, you'll be okay. Just follow your doctor's advice. Everything will be fine. She took me into one of the empty consultation rooms. She showed me her scar where her surgery was done, basically trying to allay my fears to let me know it will be all right. I picked courage from that woman. And guess what? I haven't seen that woman again ever since that day. But God used that to give me courage. Well, this was on a Friday, so that weekend was a black weekend for me. I cried all through. It was really a traumatic time for me. Well, after crying, um, I picked up myself and I reported back at the clinic on Monday morning. Of course, That was because I had a lot of support. One of my sisters-in-laws is a pharmacist. Her husband is also a pharmacist. They had spoken to me, they had counseled me, they had called on many of their friends who were medical doctors to talk to them. You know, everybody just rallied round. And the consensus was that you need to start treatment as soon as possible. So I listened and I obeyed. In the midst of so much anxiety and fear and not knowing what to expect, I reported at the clinic on Monday morning for chemotherapy. Remember, because I had stayed 6 months before this malignancy was picked up, my tumor had now grown very large. So I can be said to be a stage 3 patient at that time. So I went in and I was told that they would not be able to do surgery for me immediately because my surgery was too big. So they decided to do what they call, I've forgotten the procedure, but anyway, I had to do chemotherapy first to shrink that tumor, to bring it under control before I would go in for surgery. So I started chemotherapy on that day, not knowing what to expect, a lot of fear and trepidation, but I did it. And and that's how my treatment started. And now I'm going into treatment. So I did chemotherapy for 3 times, and then I was supposed to go in for surgery. But somehow, I can't explain what happened. There was a miscommunication between my doctors in Port Harcourt and the radiation oncologist that I was consulting with, who was based in Lagos at the time. So I was sent for radiation after 3 cycles of chemotherapy. I went to Lagos. I was in Lagos for about 6 weeks undergoing radiation therapy, after which I came back. Sorry, I got that wrong. I did 3 cycles of chemotherapy. I did surgery, and then I did one more cycle of chemotherapy before I went to Lagos for radiation therapy. And then I came back to Port Harcourt and I did um, other cycles of chemotherapy. In all, I had 8 cycles of chemotherapy. Now, this chemotherapy was quite traumatic for me. When the doctors told me what chemo medicines would be used for me, I went online. I did a lot of research, read about the drugs, read about the possible side effects and all of that. So I kind of knew what to expect. And so when I started experiencing those side effects, it was like me ticking the box that, oh yeah, this was going to happen and that was going to happen. One of the things I read online was that I was going to lose my hair exactly 14 days after the first chemotherapy. Of course, as a Christian, I kept casting and binding and telling myself my case will be different. I'm not going to lose my hair, because they say some people don't lose their hair after all. I'm not going to lose my hair. I'll be one of the exception and all of that. Guess what? On that 14th day exactly, my hair fell off. I had very long hair at that time. My hair was really long. For those that know me, some of people that know me very well are participating in this event today. I had very long hair. The first place where I noticed I was losing hair was in my pubic area. I was taking my bath that morning on the 14th day that morning, and as I was washing my pubic hair, I noticed that the hair was just falling out for no reason. And that's when I knew, oh yeah, so when I'm combing my hair this morning, my hair is going to fall out. And yes, as I combed my hair that morning, my hair was just going out with the comb. So I lost my hair. Well, all of it didn't come out on the same day. But because it was traumatic for me, um, I contacted one of my friends, and both of us decided to just go to a barber's shop and get my hair cut off. So I barbed my hair, and now I had very low cuts. Guess what? Even the little hair that was left on my scalp, whenever I'm taking a bath and I wash my hair, the little strands would just fall off until I became completely bald. By this time, I was so traumatized because when I looked at myself in the mirror, I couldn't tell who this was. It was so traumatizing for me. My hair had gone off. So the only thing I could, the major feeling I felt at that time was I felt I was dying gradually. I felt I was just going and going and going until I finally died. That's how I felt. Now I've come to understand that that wasn't the case. All I was experiencing was basically side effects of the medicine I was being given for chemotherapy. What the drug does is to kill all rapidly growing cells, and the hair cells are one of those. And then after a while, the cells, because they are rapidly growing cells, they would grow and your hair will come back. So as I speak to you, my hair is fully back. I have long hair. My hair is back as normal can be. Well, that was just one of the side effects. Another side effect I suffered was that my nails were all black, my palms were dark. I had a lot of dark patches all over my skin. I experienced a lot of tiredness. I experienced a lot of nausea, a whole lot of side effects. But I'm glad I came through it and I'm here standing today. Now, I was able to go through all of that because I had support. Support is so critical from every quarter. My greatest cheerleader was my husband. He was so supportive and he's still very supportive even today. He was so supportive. He went with me every step of the way. At the time, I had to be in Lagos for radiation therapy, even though we live in Port Harcourt, Nigeria. He traveled to be with me in Lagos every weekend. My husband would come on Friday and return to Port Harcourt on Monday morning. At that time, my sister-in-law was back home with my children. I had had my two daughters. My daughters were young at the time. One was 7 and the other was 4 at the time. So my sister-in-law helped to take care of them at that time. I had friends who would check on my children for me when I was not around. I had friends who I could call even when I wasn't around to say, oh, my children need chicken. Can you please buy them some? They've run out. They need Milo. Could you please buy them some? And my friends would rally around. They would do that for me. I had another friend who would happily do school run for me. She'll pick up my children in the morning and bring them back home in the afternoon. So I had support from all quarters. From all quarters. That was so critical to my survival. It made the journey bearable, it made it easy. I didn't have to worry too much. There was always somebody somewhere who would offer some help, and I'm grateful to them even till today. Facilities. Well, I was privileged to have access to a private clinic in Port Harcourt. I prefer not to mention the name, where their facilities were top notch. I had very good care. I had doctors who were professionals and who did the job professionally and with their hearts. They were very, empathetic towards my situation. They were very encouraging. You know, I remember one of my doctors asking me, Madam, what do you do? And I tell them, oh, I'm a businesswoman. Said, Madam, carry on with your business. Travel if you have to. Once you are done with your chemotherapy and you recover a bit from the side effects, go ahead, do your business. Just do your business. Live your life normally. You will be fine. Those words were quite encouraging for me. So I had good care. I had access to good facilities. Please put up that back. I had access to fantastic facilities and I enjoyed the care that I got from them. Spiritual influence support. I can tell you for a fact that you can't go through this journey alone. You need some supernatural power to keep you going, to propel you forward. to, to give you hope along the way. Because nobody can tell you for a fact that you would be among the statistics that would survive this disease. Everybody will only do their best for you. And so you have to find courage from within. You have to find courage from one that is higher than you. And I did tap into that from God. God helped me all through this journey. I can tell you that it felt as if He was holding my hand through this process. Each time I was on my hospital bed, I listened to music that encouraged me. I listened to messages. I would listen to the audio Bible. You know, a lot of a lot of the word of God had to be on my inside for me to find hope and the courage to press on. One of the scriptures that ministered to me the most at that time was Lamentations 3, I can't remember now, maybe 3:23 or so. That because of the Lord's mercy, I am not consumed. Truly, I wasn't consumed, even though the storm was raging, but I wasn't consumed. Life after. I'm grateful to God that I'm back on my feet. I am living a normal life. I do a lot of advocacy work today because I found hope with that lady who showed herself to me and who encouraged me to get started on the treatment and who let me know that I can beat this. That meant a lot to me. And so today I am trying to extend the same hand of fellowship to victims of this disease. By the way, at some point in my journey, I had the privilege of going to the US. Now, shut that door properly, please. I had the privilege of being in the US. And while I was there, I came in contact with a non-governmental organization by name SLEW. SLEW was founded by a woman who had been through breast cancer and who had survived it. But when she was going through her treatment, she realized that there are a lot of women who do not have good enough insurance to cover their treatment. And so she decided to help women who cannot pay their hospital bills and who do not have insurance to help them. Anyway, she runs this NGO and she has different departments in her office. She has the psychotherapy department where a psychotherapist talks with you and tries to understand how you feel, helps you through that journey, advises you on what to do, generally guides you. She had the patient navigator who could go with you to the doctor's office and help you ask the right questions. Remember, a woman who is a victim of breast cancer is devastated at that time and she may not be well coordinated. And so this patient navigator would help that patient go with the patient to the doctor's office and help to ask questions. They had the lymphedema massage therapists, special massage therapists that would help patients who are cancer patients. The type of massage they need is different from the regular massage that an average person gets. They had a section where they would measure you and give you the free prosthetic breast form that you would need, having gone through breast surgery called mastectomy. They would give you the swimwear. They would give you the specialized bras. They will give you the prosthetic breast forms and many other things that you may need. I saw all of this and I thought to myself, I wish I could do this for women in Nigeria, but I didn't know the how. So I went to speak with the president, the founder of that NGO, and she said, well, Dayo, I do not know how it works in your country, but I'm willing to support you. So she said, one of the major things I really wanted to do was to be a lymphedema massage therapist, because when I was going through radiation therapy, I came across a lot of women who had breast cancer and were suffering lymphedema. By the way, lymphedema is swelling of the hand. I can't go into too much details now because of time. But basically, the arm swells up because the lymph nodes for the woman who has had breast surgery in most cases are removed, the lymph nodes under the armpit. And so the woman suffers swelling on that hand. That can be very inconveniencing, it can be very painful, it can be heavy. And in fact, it can be incapacitating. So I saw a lot of women who had that condition, and I wish I could help them because abroad they had the massage therapists who are skilled because there is a science to it. They would use their hand and manually drain that lymphedema over time. I wish I could do that for women here in Nigeria. And so the founder of this new now said, okay, why don't you undergo training for lymphedema massage therapy? So I looked around, I scouted around for the training. I found one in a nearby city, somewhere near where I was staying at the time. I flew there, I paid my way, I flew there, and sorry, not for the lymphedema massage therapy. I couldn't undergo the lymphedema massage therapy because I do not have any medical background. So I had to cancel that. So we thought about it again, and then we decided that I should learn how to fit the prosthetic forms and the bra. And that was what I went to train for in Dallas. So I did that. So when I came back to Nigeria, remember the founder of that NGO had promised to help me. She told me she would send me some breast forms and she would send me some mastectomy bras, which she did eventually. She sent me quite a few. Now I have these breast forms, I have the mastectomy bras. How do I now get in touch with the women who need all this? So I went to UPTH at the time and I went to introduce myself to the surgery department, to the head of department surgery. So that, because they are the ones who come in contact with these patients who need to do surgery. So, and that's how I got started. So they started referring patients, breast patients to me, and then we started fitting them and we gave out all that we had for free. We didn't sell any of them. And that's how this foundation started. The name of LP Sapphire Foundation the name LP Sapphire Foundation was born out of our desire to give hope to victims of this disease. LPs is the Greek word for hope. Sapphire is a gemstone, and our goal is to support women who have breast cancer, support them, give them hope through this journey until they come out shining like a sapphire. That is our goal. And that's how we started LP Sapphire Foundation. And from then on, we've had contact with several women from both within Port Harcourt and from all the parts of Nigeria. I've had a woman come to me from Ile-Ife. I've had somebody come to me from Owerri, from Kaduna, from Benin, for me to fit them for these breast forms and the mastectomy bras. Right now, we are out of them. We don't have any. And we don't have any donors who have promised to give us any at the moment. So we currently don't have. But that's how we got started. And so when we ran out of these items, it was now like, so what can we do? What else can we do to support these women? We started support group meetings, which is something I picked from that NGO in the US. Support group meetings are forums where breast cancer patients come together. You share your fears, you share your joys, you share your pain, because we all speak the same language. We understand what the other person is going through. So we have support group meetings once every month. We've not had the support group meeting for a while now because of the COVID-19 pandemic. However, we hope to resume early next year. But prior to this time, we have our support group meetings once every month. We reach out to patients, we visit indigent patients, and where we can, we offer and render financial help to patients who are indigent and cannot pay for their treatment. There are so many of such people. So yes, that is my life after. I'm a breast cancer advocate, really advocating that breast cancer can be survived if picked early and treated promptly. In addition to that, I run my business, I run my family, I'm a mother, I'm a wife, and I just live my normal life. I think I would stop there. But before I go ahead, let me give you some statistics about breast cancer. Excuse me. Breast cancer and cervical cancers are number one killers for women worldwide. 1 out of 8 women will have breast cancer in their lifetime. That's what statistics say. In Nigeria, 1 woman dies every hour from cervical cancer. 40 Nigerian women die daily from breast cancer. Isn't that alarming? I've told you about the origin of LP Sapphire Foundation. Let me now share with you the challenges, the general challenges that we have observed generally in our immediate environment with respect to breast cancer. The first is inadequate awareness level. A lot of women do not even know anything about breast cancer. And so when they are experiencing symptoms of this disease, they do not know, they don't pick it on time. And if this disease is not picked on time, the mortality rates ultimately will be high, as with what we currently have in Nigeria. And that is what somebody like Dio is trying to fight, because if the awareness level is high, people will pick it on time and people will understand that the disease can be survived if treated promptly. Lack of knowledge on self-breast examination. If I take a toll here today and I ask how many of you know how to do your self-breast examination, you'll be shocked that not many women know how to do that. I'm hoping today that maybe the doctor who is in our meeting today will teach us how to do that, and that will be something for all the women here to go home with today. For those who know how to do their self-breast examination, the question is, do you do it regularly? Do you do it consistently? It's one thing to know, it's another thing to apply the knowledge. Denial. There are a lot of women who have symptoms, visible symptoms, but are in denial. Oh, it is not my portion. Even when doctors have given you the diagnosis and told you this is what is happening, you say it is not my portion. And then you run away, you don't come back for treatment. Of course, the disease gets worse, and then it gets to a point where all they can do for that patient is to give the patient palliative care. Religious and cultural beliefs. Some people will say, if I go to my pastor and he anoints me or he gives me the miracle handkerchief or something, I will be okay. Well, this has put us in trouble in many cases. God heals. I'm a testimony that God heals. If God didn't heal me, I won't be here today. God heals. But the thing is, God heals different people in different ways. Some of us will be healed through the expertise of the medical personnel. There are some challenges in our medical system. Bureaucracy. When you go to the hospitals, the stress, um, our state-owned hospitals or maybe even government hospitals, is just so difficult to navigate to get what you need. You will pass through some level of stress. And sometimes that stress puts people off and they just walk away. Expertise. In Nigeria, we don't really have so many oncologists. We have a few. In Port Harcourt, for example, we have only one oncologist, and I'm not sure, but I hear he covers quite a few. It covers quite I don't know if he covers some states or he covers quite some areas. I wish we had many more of such people, oncologists. In Nigeria, most of the people that treat cancer patients are surgeons. They do a good job. I'm not saying they don't. But you see, I think we would even do better if we truly had oncologists on ground everywhere, readily available all the time. The few that we have are overwhelmed. They are really overwhelmed. I can go on and on, but I think I want to stop there. Finance is another challenge. Treatment of cancer, any type of cancer, whether breast cancer or any type of cancer, is very expensive. So finance is something you can do to help people who are indigent. The rich also cry because cancer doesn't know the poor nor the rich, the middle class, the low level person, the high class person. It cuts through all strata. But if an upper middle class person can struggle while going through cancer to pay their bills, how much more somebody who is indigent? If you're already sick and now you cannot even afford treatment, it's a bad place to be. I've had to support people who are going through chemotherapy and do not have food to eat. And I mean food. So sometimes I'm going to visit them. I will buy eggs, I will buy rice, I will buy semovita, I will buy oil. It's crazy. So honestly, if you know anybody who is going through any form of cancer, please, if you can, support them. Nothing is too little. It will help. Radiation therapy is something that is a big challenge in Nigeria. We do not have the machines readily in the different states. I had to leave Port Harcourt to do radiation therapy in Lagos. We currently don't have any machine in Port Harcourt. I understand one is working in Owerri currently. Owerri is about, I think it's about 2 hours drive from Port Harcourt. That's far. And you know, when a patient is going through radiation therapy, the person now has to pay for accommodation because that's not your usual environment. So you have to organize where you are going to be putting up for the period when you'll be going through radiation. That's a lot of inconvenience. Let me stop there. Thank you.
Thank you so much, Mrs. Ojo. Thank you so much. And without much ado, I would like to bring up our next doctor, Mrs. Ojo. Thank you so much. You're still with us, and we'll ask you all the questions afterwards because she supports post-diagnosis, women in post-diagnosis. I hope I'm saying the grammar right, Sha. You know, at different levels. And for me, what was so touching was as little as buying ugu can make a lot of impact. For me, that was quite shocking. You know, but yeah, thank you. I will take all those questions. I have a lot of them here. So without much ado, I would like to bring up our next speaker. So Dr. Yetunde Odusolu is a public health physician and a member of the West African College of Physicians. A practicing doctor of 17 years, she is senior registrar at the Lagos State Teaching Hospital, LUTH. She holds a postgraduate degree in pediatric nutrition from Boston University and certified in leadership and management, economic evaluation, and project management from University of Washington. Dr. Odusolu is a member of the Action Health Incorporated, AHI, a non-governmental organization established in 1989 dedicated to promoting young people's health and development to ensure their successful transition to a healthy and productive adulthood. We are privileged to have her speak with us today on how to be proactive about our health with respect to breast cancer, and looking forward to her answering our questions from the expert point of view as well. Thank you so much, ma'am, for being here with us. I will now take a virtual step backwards and welcome you. Thank you.
Okay, thank you so much. Can you see my screen?
Yes, we can.
Can you see my screen?
Yes,
okay,
we can.
Thank you very much. Okay, so briefly, just maybe in the next 15 minutes thereabouts, talk about breast cancer awareness and the preventive practices. So by way of introduction, I believe the first speaker has already whet our appetite and told us, our own experience about breast cancer. So by way of introduction, I'll be taking us through this outline, the introduction, what breast cancer is just about, causes, the types of breast cancer that we have, the risk factors, the symptoms and signs, the diagnosis, treatment, and prevention. So breast cancer has been said to be one of the commonest cancers that affects women globally. Even in Nigeria here, it's a cancer that affects 1 in every 8 women in Nigeria. And globally, 500,000 women have been said to die of breast cancer annually. In Nigeria, we find out that breast cancer is a cancer that should not kill women, because it's a cancer that women are empowered, that you can easily detect early. But you find out that even despite that, maybe because Nigeria is a low, medium, and income economy, you still find that many women still come down with their diagnosed at the advanced stage of breast cancer, which where that even when you intervene, the survival is very, very poor. So breast cancer is now ranked among one of the number one cancer in Nigeria, by sites, because it is the 22 of all the cancers that we have, maybe cancer of the cervix, of the brain, or any cancer of any part of the body. Breast cancer accounts for over 22.7%, and that is number one, and is the number and causes death in about in women 18 point of all the deaths of women in Nigeria. Breast cancer accounts for 18.6% of that, and that's a very big figure considering the population of women that are in Nigeria. So what is cancer, by the way? Cancer is just, we'll say, is an abnormal growth of cells. When cells grows abnormally beyond their boundary. And of course, breast cancer is cancer of when the cells in the breast tissue, they grow without control. That's just the basic definition for breast cancer. So you can see a picture of a breast muscle, the fat. The breast does not have a muscle. It contains of fat, ducts, and lobes. It's the bone at the back of the breast that you can say that has maybe a little muscle. So the breast is not a muscle. You cannot exercise the breast, like so to say. Then, okay, this is the picture of a normal breast. I'm not sure my point. If my points are working, the A part of the breast showing the dots, the breast has some lobules. The C part is the dilated dots, which holds the milk, that when the woman wants to breastfeed. We have the nipple. Of course, we all know the nipple. The nipple is the pointed part of the breast, and the breast lies on the muscle, like I said, on the muscle of the chest wall, which we call the pectoralis muscle. And of course, it lies on the chest wall. Then, looking at the closer look of the dots, that is where we usually have breast cancer developing. Sometimes in the dots, in the lobules, these are the areas. That picture, that is this circle that you can see. That's where the picture where breast cancer usually develops. I don't want to bore us with so many non-technical medical jargons. So, thinking, okay. This is a breast gland also. Each breast has 15 to 20 sections of lobes arranged like a petal. See, this is petals, and see, you can see this picture down. This is how the breast is arranged, and inside each lobe are smaller structures called lobules. And of course, at the end of each lobus are tiny cells called bulbs, which produce the milk. I just want us to have a cursory look of our breast. Then see the dots. The dots carry mix from the dots bulbs towards the dark area, the nipple, which is where the baby sucks from. And that is where the milk is delivered, at the areolar area. So it has a network. The breast is a network of tissues. It even has a network of nerves, blood vessels inside it. So we have the lymph, we have the blood vessels that are inside we have the lobules, and we have the lymphatic vessels. And I will mention these ones later, because these lymphatic vessels are the ones that aid if there is a breast cancer and there is what we call spread, which we refer to as metastasis. It's those lymph vessels inside the breast that help the spread. So what are the causes of breast cancer? Technically, we will say that, most breast cancer, we will say that there's no cause. We don't know, because even most cancer, we say there's no cause. But we say there are risk factors, things that predispose a woman to having breast cancer. But it has been usually said that breast cancer is usually caused by gene mutations due to genetics. which can be spontaneous or maybe something that is inherited. When you find a woman that has breast cancer, it's likely that her sister, her daughter may likely have breast cancer. That is what science has told us. So there is this science of genetic inheritance that breast cancer can prove. But it's not all women that have breast cancer that is through inheritance. Some may not even have history of breast cancer in their family and they end up having breast cancer. So never say never. So most breast cancer are diagnosed in women are not due to inherited, like I said, they are not due to mutations. You may not even know the cause. And you just find out that the woman has, I will tell you my own story later. So let's continue. So what are the types of breast cancer? We have what we call the inflammatory breast cancer. We have let me just run through the different types. We have the Paget disease of the breast. We have the triple negative breast cancer. We also have the one that is called colloidal carcinoma cancer, and these ones are the ones that usually occur in the ducts. So we have what we call intraductal carcinoma, intralobular carcinoma. Then we have papillary carcinoma. So there are some conditions that we find in the breast that are not usually breast cancer, because we like the first speaker said that you should always check your breast. It is not every time that you discover any change in your breast that we will say, okay, this is breast cancer. There are some changes that may be found in the breast that are not actually breast cancer. They are not cancerous. And so those situations, they are termed as benign, that they are non-cancerous. That means they are not prone to turning into abnormal cells. So one of those is like when a breast undergo what we call a fibrocystic change. Another one is when we have the breast tissue undergoing, just growing. We call it hyperplasia. It's just growing, but it is not cancer. There are also some instances where we have what we call cysts. Cysts are like sacs that are filled with fluid inside the breast. So somebody that is feeling the breast may feel something like looking like a lump, but looking cystic, like maybe when a physician has examined. That cyst is not breast cancer. We also have some situations where a woman may feel maybe something that is they look like fibroadenoma. They are lumps, but they are filled with calcification. Those ones are not breast cancer. So it is not all breast problems that are breast cancer, but we need to have a high index of suspicion even in checking our breast regularly. And of course, we need to see our physician to know how to rule out whether any finding in our breast is breast cancer or not. We cannot just know that by ourselves. So, like, okay, these ones are the ones that I mentioned earlier. Non-cancerous conditions of the breast. Like I said, we may find lumpiness, thickening, and swelling around the breast. Sometimes, I will still come back to that. When we talk about breast examination, we will tell you there's a period that you're supposed to examine your breast. When you are a woman is during a period, a menstrual period, the breast is usually lumpy. For people that are usually observant, you notice that your breast is usually lumpy. So if you examine your breast around that time, you may not really know whether you have a lump or not. So there are some cystic changes that also occur too inside the breast, which may occur around the woman's period. So we will know say that one is breast cancer. Like the cyst I mentioned earlier, they are like just lumps that are filled with fluid. They are tiny, but they will look lumpy when the woman examines it. Some may also, like the fibroadenoma that I mentioned earlier, they are solid, they are round, they are rubbery. When the woman feels it, it occurs mostly in young women. These ones we not say they are breast cancer. All these ones too, they need to be treated though, but they are not breast cancer. Then we also have sometimes infections. Maybe the breast will just be tender, painful, lumpy, warm. The person need to see a doctor. It may just need to be the person need maybe a course of antibiotics, and the infection will clear up. And also, the trauma to the breast can also create lump in the breast. So those are non-cancerous conditions of the breast. Also, there are some cases where we have some things we call calcium deposits. That can be found inside the breast. They are called microcalcifications. Maybe they are usually found when they examine them through mammogram. I will still come to that. That's an examination for the breast that the woman is supposed to undergo, depending on the age of the woman. So when they find some of these microcalcifications, some of them may not really be cancerous, but it may also point out to a precancerous condition. So that means they need further investigation to know whether this the condition the woman has is cancerous or not. Now, what are the risk factors? When we say risk factors means that what are the factors that predispose a person to having breast cancer. Now you say, okay, if the person has this, there is a tendency that somebody that has this kind of condition can have breast cancer. Women that are usually older, women that are older than 50, women that are postmenopausal, the risk of breast cancer increases as the woman gets older. Another reason is when a woman has, when we have genetic mutations, like I explained earlier, there are some genes that have been associated with breast cancer. If they test the woman and they find these genes inside this woman, they call them BRCA genes. BRCA1, don't let me, it's a big term, but it's like when they do this test, they find, it can predispose somebody to having breast cancer. Person may not have breast cancer, but if you have this gene inside you, they test you and they find that gene, this BRCA1 and BRCA2 gene, it means that the person has a tendency of having a genetic mutation that can result into breast cancer. Another factor that can predispose a woman to having breast cancer is the reproductive history of that woman. It has been said that for girls that started their reproductive, they attain menarche early. Menarche is when a girl starts menstruation. If they start before the age of 12, that means they're exposed to a lot of hormones. And if they end up even having late menopause, those kind of women, there's tendency for them to have breast cancer, because breast cancer is usually, some are due to hormonal imbalance. And those hormones that they call estrogen particularly is implicated in breast cancer. So if these hormones are, a girl that has been menstruating has a prolonged period of exposure to this hormone, so that tips that person to, the tendency of having breast cancer. It has also been said that women that have dense breasts, their breasts are dense, they have the tendency of having breast cancer. Also, if there is a history of breast cancer in the family, maybe the sister, first degree relative, like a sister, a mother has had a cancer, there is tendency for that person to have cancer. There was a story of a woman in USA. The mother had breast cancer. And the lady said that, my mother had breast cancer. Me, I know that I'm going to have breast cancer. Let me remove my breast. I don't even want to. So she had bilateral mastectomy. They removed her breast. So she had not had breast cancer, but she removed her breast because of the fear that, she has this genetic tendency to have breast cancer. Also, when women have history of exposure to radiation, this is usually rare because radiation is also a treatment for breast cancer. So it means that people that have breast cancer, there is risk of recurrence if they have the radiation, but it is rare, but it can occur. Like I said, risk factor, it doesn't mean that they will have it. Then it has also been said that some women, they took some drug. They call it diethylstilbestrol. It is to protect against miscarriage. And this drug, it has estrogen. It can stimulate the pathway for which a woman can have breast cancer. So those are, in short, the risk factors for breast cancer: the age, the reproductive, the cycle of the woman. There are even some OCPs too, oral contraceptive pills, have been implicated in breast cancer. I think I did not indicate that one yet. Okay, another risk of breast cancer is when you are not active. You are living you are just sitting down. Women are not physically active, have a higher risk of getting breast cancer because they will be obese. Obese women, obesity is a tendency to having breast cancer because obesity predisposed to more of the hormones that can tip the person to be having breast cancer. Being overweight, especially after menopause, and of course, that women that are, most of the women that are usually, like I said, older women, some of them, they end up not working, being active, and you can see them getting fat, and they already entered menopause, then breast cancer may come knocking at the door. Also, if women are taking hormones, some hormones can, like I said, like OCP drugs, has been implicated in breast cancer. Then people that drink alcohol, smoking, all these are risk factors for breast cancer. Even smoking is a risk factor or an alcohol for so many cancers, smoking especially. It has been implicated in so many other cancers. Lung cancer, cancer of the cervix, cancer of the prostate, any cancer of the lung, kidney, liver, this smoking. So smoking is a very is a risk factor for so many cancers. So this will play a role when we're talking about the control for the disease. Now, what are the symptoms and signs of breast cancer? Those are the things that you will see that you say, okay, this person is tendency that is likely to be a breast cancer. One, when a woman observes and see that there's a new lump in the breast or underarm, the armpit, you've seen a lump in your breast or underarm. The lump can also even be in the in the underarm is the armpit. We call it the axilla medically. So, and with that, you also have associated thickening of the breast. The skin of the breast is thickened, and maybe there is a swelling of the part of the breast. There may also be what we call dimpling, dimpling of the breast skin. Some of us know the skin of an orange. How the skin of an orange looks like. Now it looks like as if there are some puckering holes on the skin of the orange. So if the breast of a woman is having this kind of dimpling or hole, on the breast, is a sign of breast cancer. Medically, we call it the pure derange appearance. Pure derange appearance. It looks like orange. Then if there are redness or flaky skin in the nipple area or the breast, those are the symptoms. It doesn't mean that all these symptoms mean that the person has breast cancer, but if a person has this sign, the person needs to see the physician so that they will do further examination. Also, if there is a pulling in of the nipple, what I mean pulling in is that the nipple is supposed to be pointing outward. But when you now find a nipple that is trying to pull in, going inward, we call it inversion of the nipple. That means even if that one is most likely is a sign of breast cancer. That's pulling in of the nipple. Then if there is a pain in the nipple area, there is also a sign of breast cancer. Then if there are discharges, it is not all breast discharge that means that the person has breast cancer. Because somebody that is discharging milk now, it may be due to maybe high prolactin, when they have a hormone called prolactin that is involved in the secretion of milk. The person may be secreting milk. It doesn't mean the person has breast cancer. But a person that has breast cancer can also have the secretion of milk, and even there may be associated blood with it. That means there is a tendency for breast cancer. Also, if there is any noticeable change in the size or shape of the breast, that is why we talk about breast examination. We'll still come back to that. It has to be, as a woman, we need to be familiar with our breast, the shape of our breast, the size of our breast. So if you are familiar with the size of the shape of your breast, and it's not even due to that you are pregnant, when you are pregnant or you are breastfeeding, and you now notice unusual shape or size of your breast, you need to see your physician. There may be something growing up inside that breast. And if there is any pain in any area of the breast, you need to see your doctor too. It may be a pointer to breast cancer. Like I wrote here, note, breast pain, also known as mastalgia, is common, and it can even be found in 45 to 70% of breast health-related visits to the hospital. So it does not mean that all breast pain are cancerous. Some may be benign. There's nothing up. It may be just be hormonal changes in the body. So it is not all breast pain that are cause of breast cancer. Now, like I said, I mentioned the signs and symptoms. You can see, I just brought this picture so that we can see the change in the shape and size of the breast. There is a lump and a thickening in here, and you can see the areola of this, the armpit of the woman. There's a discharge here. There's one that we call inversion. This nipple here is turning inward. There is one that there's a change in color and appearance of the areola, the dark part of the nipple. And if there are redness of the skin and something that looks like dimpling, then you need to see your doctor. Sorry, there are graphic pictures I'm trying to see. These are advanced cases of breast cancer. This is a locally advanced disease. In this case, this person has, the person just skin black. The person is presenting late, and the breast cancer, the cancer has eaten deep into the tissue. So it is becoming fungating. Sorry for this picture, but I need to let us see that there are different degrees of breast cancer. This is another woman. See breast cancer with This is obviously a breast cancer. We can see the picture, the fungating mass, the way the thing is looking. And this person, maybe they presented late, they have not been truly observant, because this thing can be caught on time. And this picture is showing the nipple. The next one is talking about, you can see the nipple. The nipple has been drawn inward. This is obviously a breast cancer. There's another one I saw. This one is they are trying to intervene. I'm sure they are trying to save the life of this woman now. See a fungating big mass cancer they are trying to cut off. People present late to the clinic. I don't know, they are part of the problems. People fear, they are afraid of their breast being cut off, so they don't want the breast to be cut off, and by the time they present, it's too late. So this is another picture of woman with breast cancer. And breast cancer, they are usually staged, and the staging of the breast cancer determines the kind of treatment that the doctor or the physician or the oncologist or the surgeon will give to the person that has the breast cancer. So we have 5 stages. We have the stage 0, we call it ductal carcinoma. That means the cancer it's just inside the breast. It has not spread to anywhere, it's just there. Then we have the stage 1. The stage 1 depends on the size. And there are stage 2. Those ones are stage 1 and 2 are also early breast cancer. If they say you have a stage 1 or stage 2, they are still early breast cancer, but it's just the staging that maybe they talk about the tumor size, the whether it has whether it is beyond the margin or whatever. That's what they used to grade it. I don't want to bore us with those details. But if it is stage 3, it is locally advanced. And if it is stage 4, it is metastatic breast cancer. When we say metastatic, it is spread to other parts of the body. And breast cancer can spread to the liver, to the brain, to the bone, to the kidney, any part, even to the cervix. So it can be found at different stages. And as I said, that the earlier we can find breast cancer on time, they say a stitch in time saves 9. The earlier it can be nipped in the bud, then the prognosis and the survival is better. So how do we diagnose breast cancer? It can be diagnosed through breast ultrasound. We are all familiar with what we call ultrasound. Ultrasound is just like when a woman is pregnant, they'll say, go and do the scan of or to say how many babies are inside your womb, or what is what's the age of the baby, or what's the size of the baby, or whatever. As in breast, I'm just trying to say what scan is. So that's kind of mechanism that they use to scan a baby inside the womb. Breast can also be scanned, and there are things that the radiologist will look out for. They will look for the size, they will look for the shape of the lump or whatever. They will even look for maybe the perfusion of the breast. Those they will use to know whether the person has cancer or not. There's another test that is recommended that women should be having, especially women. When a woman has passed 40 years of age, it is advised that women should be having breast mammogram at least once yearly. Mammography, it can also help to diagnose breast cancer. Then there's another we call the magnetic resonance imaging. These are advanced testing method to see whether the person has cancer or not. There's another one which I didn't put here, which is called biopsy. If a woman has a lump in the breast and the physician is not sure of what the breast lump is, there are some lumps that a physician will see that this is a fibro, like I said, the non-cancerous ones. This is a cyst. This is a fibrinoma. They will just go and remove it. But for any lump that the physician finds suspicious, they will tell the woman to go and do a biopsy. A biopsy is like a definitive diagnosis to find out what is the character of this breast cancer that the woman has. And it will also determine the treatment that they will give the person. And so that brings us to different types of treatment of breast cancer. It can be done through surgery. Surgery involves you can remove part of the breast, just removing the lump. You call it lumpectomy. If you remove the whole breast, you call it mastectomy. There are some instances of people have to remove their both breasts, and sometimes they may even have to remove all the lymph nodes. Lymph nodes are those inside in the armpits as well. They may remove them. So because those are the ones, like I said earlier, they help in the spread of the cancer. So they will clear those areas, for the person that has the breast cancer. And also the surgery can also goes along with reconstruction. Some women, they said, they will cut my breast. What will now happen? Thank God for science. Breast can be reconstructed. So if a woman has had mastectomy, it can be reconstructed just as people can reconstruct. In fact, science can do so many wonders now that we see. You see a man that had this phallus cut, I mean the penis, they reconstructed it. So breast is not something that cannot be reconstructed. Then there's what we call chemotherapy. Chemotherapy means the use of drugs. We call them cytotoxic drugs. They use it and they kill the cancer cells. But sometimes those drugs, when they are given, it's not only the cancer cells that they kill, they also destroy part of the normal cells in the body. So those are one of the major side effects of the chemotherapy, but it's still better. Yeah, and there are some drugs that are now being produced due to technology that they will just target only the cancer cells. Then we also have hormonal therapy. There are some women that have cancers that are due to hormone, the estrogen sensitive tumor. They are sensitive to the hormone called estrogen. So they put them on hormonal therapy. And when they put them on that hormonal therapy, it helps to suppress or stop the breast cancer from growing. Then also there's what we call the targeted therapy or biological therapy. It is also a form of, they use drugs that target the immune system of the woman so that the woman can target those cancer cells. Another treatment is what we call radiation. Like, the first speaker said, you mentioned about radiation therapy. Radiation involves the use of, some of us, we say we go for chest X-ray. Go and do chest X-ray. Have you done X-ray before? So those the kind of mechanism that they use chest X-ray, this one, there are now some X-rays that are, packaged, and there are those the dose of those X-rays are now targeted towards the breast alone. It's a local treatment. It's just targeted towards the area where the woman has breast cancer. And of course, science is trying to help us to. There are some ongoing trials for vaccines to see that whether we will be able to treat cancer with vaccines. Then this is a picture of a woman with that has undergone reconstruction for breast cancer. This is a picture of another woman that also, like I said, she had had surgery, maybe a lumpectomy, they have removed part of the breast, they will just reconstruct the breast for the woman. So now we come to prevention, which is the basis of our meeting here today, because they say prevention is better than cure. So we need to be aware of our breast. We should know our risk. We should know what is normal for us. We should be get screened, and we should also make healthy life choices. So I'm speaking on prevention based on these 4 outlines. So know your risk. Know your risk involves also knowing the risk factor. Like I mentioned, there are some risk factors that are controlled, that you can control. There are some risk factors that cannot be controlled. Some risk factors that can be controlled, like smoking, alcohol, the use of drugs, they can be controlled. But risk factors like genetics, can you control genetics? Can you control the person that gives me and say, oh yeah, they gave me back to me. I don't want to belong to this family again. You're already there. It's genetic. You cannot control that. So you talk to your mother or your family about your family history. Is there any history of cancer in the family? Maybe the first generation, the grandmother, mother. And of course, it's not as if this one just make you to be conscious so that you and heighten your sensitivity so that you'll be able to see your doctor on time, get advice, so that you talk about your risk of having breast cancer or not, so that they will prescribe screening for you. If somebody that has history of breast cancer in the family, the way the person will be seeing a doctor will be different from somebody that doesn't have history of breast cancer in the family. The person may need to often have more screening than the person that does not have the history. Also, know your risk. They're talking about risk factors. Of course, being a female is a risk factor for having breast cancer. Men also have breast cancer. Maybe if 1 in 2 or 1 3 women who have breast cancer, maybe 1 in 10, 100,000 men we have breast cancer. So men also have breast cancer, but it's not common as we see in women. So then, like I said, if you are overweight, you need to watch your weight. You need to exercise to reduce your weight, to reduce so that the risk of having breast cancer will be reduced. Because like I said, women that are overweight or obese, even after menopause, they have the tendency of having breast cancer. So you need to exercise, to reduce, that overweight can be a tendency to having breast cancer. Then you need to stop consuming alcohol, reduce alcohol intake. Then it has also been said that breastfeeding is protective. That's why we always tell women that come to the clinic that they should breastfeed their children exclusively, especially for the first 6 months of life. when you breastfeed your children exclusively it is protective, for breast cancer. But it does not mean that women cannot have breast cancer. But at least it is protective. Exclusive breastfeeding is protective. And when you breastfeed for at least 2 years, it is protective for breast cancer. Then also, if you are getting older, you need to know that you need to do checkup more regularly, as you are getting older, check up more regularly with your physician, so that because the risk of breast cancer increases with age. So then we need to know what is normal for you. This brings us to what we talk about self-breast examination. Self-breast examination, we have 2 types of examination. There's what we call self-breast examination. Another one we call it clinical breast examination. Self-breast examination is the examination that you as a woman, you do by yourself, and you do it every month. It is just like a woman has monthly period. We enjoy women to have their breast examined every month. And the clinical breast examination is the one that will be done for you by the physician. So for you to do a breast self-examination, it is advised that for women that are not yet attained menopause, the best time to have their breast checked is maybe preferably 5 to 7 days after their menses. You can remember that I saw that when women are usually having their menses, their breasts usually feel lumpy or feel lumpy. So if you examine your breast while you are menstruating, you may have a false positive diagnosis. You may think I have lump in my breast, whereas it is just normal. So 7 days after your menses, the breast tissue will return back to its normal position or state. That is the best time to examine your breast, and that is when to know how your breast look and how your breast feel like. So how do you do your breast examination? Well, from the picture here, I'll just say that when you want to do it, there are 3 main ways in which you can examine your breast. You can examine your breast standing in front of a mirror, like this woman is standing. It's like standing in front of a mirror. You can examine your breast while you are having your bath. When you have your bath, you have soap on your body is soapy, your hands can easily move over your skin. Then the third part is when you are lying down. You can see the woman that is lying down there. You can examine your breast while you are lying down. But it's best to first examine in front of a mirror, because you are the one that will know how your breast looks like. You stand in front of a mirror and you stand with your hands akimbo. You can first start with your hands by your side. Well, this woman, the first picture that is showing, you're saying the woman is raising her hands up. So let me say that you put your hand by your side, you gradually raise your hand up, and you are looking into the mirror. You are looking at the size and the shape and the skin of your breast, the size, shape, the nipple, and the movement. So you are looking at the size of your breast. Is your breast unusually bigger than the other? Like, that's why you have to be familiar with your breast, so that when you notice a change, and when I say examine your breast, it's not, I say every month, not every day, not every 2 weeks, not every week. If you do it every week or you do it every day, you will be too familiar with your breast that even if there is any change, if there's something growing as small as a bean size, the size of a bean or a corn size, you will not notice, because you are too familiar with your breast. So that is why we say every month, because it's easier for a woman to know that, okay, this is what I saw last month. What I'm seeing here was not there last month. So you gradually raise up your hand, and you raise up your hand up, and you will now see whether the breast is moving up. If you raise up your hand, your breast tissue is supposed to move up as you are raising up your hand. But if you find that the breast is not moving up, one breast is not, it's just doing as if it's just, sorry for using that word. The breast is just static like that. You know that there's something going on inside that breast. And if the nipple changes, the nipple is going inward, or there is a unusual redness around the nipple, or the nipple has crossed, like I mentioned earlier, you need to see your doctor. And if you notice that there is the skin of the nipple too, they are dimpling on the skin of the breast, they are dimpling on the breast, the skin changes on the breast, or redness, or any changes you have not seen before, you need to see the doctor. If you notice that the shape or the size is different from what you have seen before, you need to see the doctor. So that is raising up your hands, and when you stand, your hands by your side. Then after that, you need to if you are examining your right breast, Sorry I could not demonstrate physically, but if examine you just picture what I'm trying to say. When you put your right hand, like this woman, put your right hand, you can do this one now while lying down, as this woman is lying down. If you're examining your right breast, you put your right palm behind the back of your head, and you now use your left, the other hand, the left, with the fingers are posed together and flat. You will now start examining your breast. There are so many school of thought. Some say you should picture your breast like you have 4 parts, like 4 quadrants. You now examine each part, the 4 parts. Some say that you can picture your breast that you go from up, down. You go up, down, up, down. But the best method that we usually advise so that you will not miss anything is to start from the outer part of outer circle of your breast. You picture your breast like a circle. So you now use the flat of your finger. You now start. You can start doing it or be doing and following me as I'm saying it now. Just be, because me, I'm doing it as I'm here. Though you're not seeing my picture, but I'm doing it. You now put your hand, your flat of your finger at the outermost part of your breast, and you will now be pressing and going gradually, firmly and gradually, and you are feeling for if there is any lump. You'll be pressing gradually and moving round and round gradually, and you're moving in constant circle, concentric circle, till you get to the tip of your areola. Then you now press your nipple to see if there is any discharge. Ideally, there should not be any discharge. It's only woman that is breastfeeding that should have a discharge. Then you should now feel the armpits. The armpits should also be felt. You now palpate, you feel the palpate the part of your breast, the armpits. The reason why is that part of the tail of the breast tissue extends into the armpits. So you must not leave the armpits out of the examination. And this examination must be done monthly. And what you have done for the right side, you do for the left. That's just the breast examination. And it's something that can be done within 2 to 3 minutes. Where you can do it while you're having your bath, you can do it while lying down. And sometimes in the bedroom, we have mirrors, so you can look at your breast to see if there's any changes. So that's the best examination. And if there's any changes, you need to quickly tell your doctor so that they will evaluate you and see if you need to go for further examination. Then, like I said, you need to get screened. That is, to go for ultrasound scan. Those tests you go for MRI, depending on how rich you know. But those basic tests, if there is a lump, they may say you need to get a biopsy done. They will take biopsy means that they will take part of the teeth to check what is this in the breast. What is this cancer? What kind of cancer is this one? What kind of is this sensitive to hormone? Is this sensitive to drug? Is this something that we can be given by radiotherapy? Is this something that we can just do surgery, remove, and the woman will be okay? It is that biopsy that we help the doctor to characterize the type of cancer, and they will know the type of treatment to institute. And another preventive measure that we can always do, like I said earlier, you should make healthy lifestyle choices. We can prevent by ourselves. Maintain a healthy weight, so we can exercise, to maintain a healthy weight. Any weight loss regimen that we know, but exercise is the best. Then limit our alcohol intake. If you are taking alcohol, some people, they cannot do without taking alcohol. In some climes, they take alcohol like water. So you limit alcohol intake because it's a predisposing and risk factor for breast cancer. Then for people that are menopausal, some women, because they are menopausal, they start having hot flashes, so they give them hormonal therapy. And that's hormonal therapy has estrogen. And estrogen, like I said, estrogen-based cancer can arise because the woman is having estrogen. So the person can limit hormone use, menopausal hormone use. Then, like I said, breastfeed if you can, but it's encouraged that we should breastfeed on this client because it reduces the risk of breast cancer and other risk factors that can be controlled, like smoking. Do not be a smoker. Do not be a second-hand smoker. You know that for this year team, this is October. Today is the last day of October 31st. Thank God we have the opportunity of presenting this breast cancer presentation before the month runs out, because this is October, the Breast Cancer Awareness Month. And so we are raising awareness for women to know about breast cancer. And the theme for this year's Breast Cancer Awareness Month, but according to the World Health Organization, is that we should give hope and we should save lives. That is the theme. Then I want to conclude by letting us know that awareness is power. If you are aware and can pick up lump on time, you can pick up changes in your breast on time. A stitch in time can save 9. Early detection saves lives. Like he says in my own, I don't have a testimony. Early part of this year, I discovered that I had something like a lump in my breast. I was like, what is this? And I was like, God. I was okay. It was around my menses time. I was okay. Don't let me wait. So, but by the time I could wait, it was now October 4th and February 4th. They were doing this cancer awareness month. I think it was even breast in February too. So I said, okay, let me just go and test. So I tested. They were doing it inside the Lagos University Teaching Hospital. I was like, let me just go in like a mystery chopper. In our own clinic at the community health, I work in the community health department of Lagos University Teaching Hospital. This is what we do. We teach women how to examine their breast. We do clinical breast examination for them. We do cervical cancer screening, family plan. We are all about the well woman, the reproductive health of a woman. So I was like, let me just go and check. Let me see what these people are doing. A mystery shopper. And of course, based on what I have had before. So they checked and I said, they did the scan. There's something there. I said, okay, no, let me just go. And I went to see another radiologist, one of their guys. Now scanned me. And I said, okay, do a scan. I did a scan. And I said, it looks like there's a lump there. There's something there. Okay, I said, okay, don't worry. I went to see the surgeon. The surgeon said, okay, we need to do a biopsy. We did a biopsy. Lo and behold, they said that it's looking like what we are talking about now. So the treatment that I had then was, I had to have this removed. I had radiotherapy, and I'm alive. I'm kicking now. So and the thing was, it was because I was away. I was checking my breast. I was checking it. You understand. So that's my own story too. I'm joining you to that Mrs. Ojo's story. You need to check your breast. You need to check it regularly. Monthly, see it. A stitch in time says 9. You can see the picture of those women that had fun getting breast cancer. So when we check it, and the breast God has blessed us. It is outside the body, unlike this service. The service is what a woman cannot easily see. Somebody has to help you to look, to see and check. But this breast is in front of your body. So we need to own our own health. So thank you very much for your time. I hope I've spent more than 15 minutes, but thank you so much.
So we've had it all. We've seen it all. Like, I'm so grateful I saw those photos. It's quite graphic, and like, you all have to take care of yourself. Like, just there's no substitute to being proactive, right, about your health. As you said, something in your bathrooms, you could have mirrors. Make it a habit of just checking yourself. You know your body. You know when it is changing. And like Mr. just said earlier on, they thought it was something else. They thought it was something else, but she knew what her body was telling her. And sometimes having that habit of awareness, knowing what works for us, knowing how we are, will help us in seeing easily when things change. The first question is, are there certain foods that cause breast cancer? And I will also tie it with that. How can we be nutrition? What role does it play in prevention or management of our bodies, pre or post diagnosis? Is alopecia one of the signs of early breast cancer? Another person asks, how early can a girl be diagnosed with breast cancer? And that another question also tying with that says, when a girl starts menstruating by the age of 9, does that mean that she has higher chances for breast cancer? I think you answered that in the course of your talk. Does somebody who usually So how can a girl be diagnosed for breast cancer early? How early rather? So
let me just take these few ones, like the issue of nutrition. Nutrition plays a very vital role, in our diet, in preventing cancer, and even if you have already been diagnosed with cancer, in managing your cancer. Because nutrition, you need to make sure that you are eating foods that are healthy, then foods that contain a lot of fruits and vegetables, because those vitamins, they have been they have been said to mop up free radicals, those radicals in the body that's predisposed to even forming cancer, that can make the cells start growing abnormally. So if you eat well, you take a lot of fruits and vegetables, you are decreasing the disposition to having cancer, even any kind of cancer. So that's why I encourage people to take a lot of fruits and vegetables. So your nutrition matters. It also helps to boost up your immunity. You have different vitamins that boost up your immunity. So when you take a lot of vitamins, a lot of minerals, it boosts up your immunity. You can also be able to fight, even cancer from even occurring even in the first instance. But there are so many other factors that come into play in causing cancer, like I said earlier, like genetics and all those things. But nutrition plays a role in prevention of cancer. And if somebody has been diagnosed with cancer, the person also need to make sure that the nutrition is on top, because cancer is a form of condition that can cause decrease the immunity of the individual. So the person needs to eat well, so that we need to boost up the immunity, even to fight fatigue, to fight stress, so they're able to beat the cancer. So nutrition is very key. Then alopecia. Cancer does not cause alopecia. Alopecia means that there is no loss of hair. The person is bald. It is the treatment that is instituted for the treatment of cancer. There are some chemotherapy drugs, cytotoxic drugs, that when they are given to women that have cancer, it makes them lose their hair. Their hair becomes dropping, friable. With time, you see that they don't have hair on their head again. It's because of like I said, some of those drugs, it's not only the cancer cells that they attack the normal cells too. So that's why you find some women, when they're on cancer treatment, they lose their hair. But the thing is, after the chemotherapy treatment, their hair can grow back, but sometimes some may not grow back. So it is the treatment that they are undergoing for their cancer treatment that makes them have alopecia. And the early diagnosis, I think talked about that earlier, that cancer is greater if the woman, a girl starts menstruating early. That means the girl is exposed and stops menstruation at a later age. It has been in the life cycle of that girl. She has been exposed to so much hormone, estrogen. So it can be a risk factor for the person having breast cancer. It doesn't mean the person will have it, but it's a risk factor for having it. Then there's a question I saw that was saying that as the question is, how long does it take for cancer to progress from stage 1 to 4? Let me tell you, cancer. When I presented, so I saw I saw the radiologist in February. I was saying I didn't know what I was seeing in January. He was telling, why are you late? January to February. Can you imagine? And yet it was not as if I had advanced whatever. So it means that cancer can progress at a fast rate. They are one of the fastest growing tumor, especially the invasive ductal type. So it can progress, especially if no treatment is instituted. And even the person is not even living healthily, not eating well, so it can progress. And for individuals, it depends. What happens for A cannot be what happens for B. You cannot say, but it has been said scientifically that it can progress at a faster rate if treatment is not instituted on time. Treatment. Is it possible to have an idea of the cost of treatment of cancer? I heard Mrs. Ojo saying that cancer, people need support. In fact, I'm thinking of seeing how we can set up a support for people that are having cancer support center or social support or support group, because it's a form of it's a non-communicable disease. That's what they call it. You cannot communicate cancer. It is not a cancer that you can say that, like COVID now. You say that if you breathe air, you can get COVID. Somebody cannot breathe air, you will get cancer. You will call it non-communicable disease. So the incidence of non-communicable disease, cancer, is very high, and the treatment cost is very high, and it is killing. So I'm sure that is why the government of Nigeria is trying to even put it in part of the National Health Insurance Scheme, so that people need to be insured. They have to be on insurance. If you are not on insurance here now, please try and be on insurance. Not even for cancer, but for any other thing, because out-of-pocket spending can kill anybody. Even for the best of person that is even making money, even if you are a middle class person, the person needs support, you need money, and the cost of treatment. Radiotherapy in Lutz now is about, at least just for go the full-blown treatment, because it's 770,000 for treatment of radiotherapy. and that is exclusive of chemotherapy. For chemotherapy, you may be spending, depending on the cost of the drugs, you may be spending millions. There was a time a woman came to meet me. She was like, she works in the same hospital with me, and she was telling me she had breast cancer. I was encouraging her, counseling, and not knowing that me too, I will still see my own. So when she now told me that the cost, they were trying to place her on one drug that they are doing the trial. And I read about the cost of that drug today. They said you need 23 doses of that drug, and one dose is about $2,000, which is about $750,000, 750,000 naira for one dose of a drug. So that drug is on trial in Nigeria now. It is only you can, how many people can afford a drug that you have 23 doses and 750,000 per dose? The cost can be killing. But if you're on insurance, the cost can be mitigated, can be reduced, and you need support from family, no doubt. So you can spend up to roughly between 2 million to 3 million just to treat basically. And there's so many. One professor of mine has talked about the cost of treatment. When you talk about the cost of treatment, how can you quantify cost? There is the cost of treatment. There is the cost of treatment seeking behavior. There is the cost of transport. There is social cost, that you cannot even quantify. There is the cost of misery and pain. Somebody that is diagnosed of cancer, can you cost the misery, the pain? The person cannot look and work again. The person is demoralized. How can you count all those costs? But when you're talking about money just for treatment, so the cost of cancer is bigger than we can just say, okay, thank you.
Okay, I'll just quickly run through the remaining questions. But before I go on there, writing on the back of the answers that you've just given now about the different costs of cancer, I know that we have audiences that are in Nigeria, that are in Canada, in North America. Some of these places, they have like free checks and free treatment to some level. But in Nigeria, I know that so many things are not free. So I'd like to ask, writing on that comment, if there is any part of this that is free, any part apart from seeking insurance, if there's any part, probably free screening or something, because one of the things we're trying to do writing on this talk is to like jumpstart this awareness in some women's mind about even going to check mammogram. If you're close to 40, that late 30s, early 40s, go check yourself. We're trying to see if we can sponsor some mammograms, but of course that's like a drop in the ocean. So is there anything that somebody can take advantage of apart from insurance, like where to go to for, if you get here, you get some screening free, or if you go here, you get some drugs at a cheaper rate or things like that in Nigeria?
Okay, as per the starting from the diagnosis of cancer, screening free. If you come to our own health department, community health department, we will screen you. We do clinical breast examination for you. That one is free. You don't pay money for that. Then also, they will also have a breast clinic in Lut. I'm not sure to the extent of which treatment that they give free, because they are the one that had that meeting I was telling you that they had in February. They organized that program. So they do screening. That screening, then they organize it. Was free. And in some of them have support from non-governmental organizations that are supporting them. So they do screening free. And also aware that some NGOs too that are also doing free mammograms. It's just that one needs to open one's eyes and hear when they are doing it. It's not as if they'll be doing it all the time. They'll be maybe in some season of the year that they'll just say, okay, we are doing this program, we are doing this free screening. Even Lagos State too, they also do some free screening for people for some non-communicable disease. Just that one need to open one's ears and be tuned to know when they are doing it. That's why you need to get in touch with your physician, because if they are doing those kind of screening program, it is your physician that they will tell that, okay, if you see women that have this kind of cancer, okay, we are doing free screening. Like they are doing free screening for women that have sickle cell disorder in pregnancy now. They are telling doctors. So it is women that come, sickle cell women that come to meet doctors, that doctor will enlist in that kind of program. Like I told you of this friend that had cancer that was being placed on trial for the drug. The drug is actually expensive, but she's going to have a free trial of that drug because it was the doctor. She went to see the doctor, and the doctor is aware that there's an ongoing trial that they are going to start. You understand? So be close to your physician. They will know when there's any free treatment, because of course people that want to do that thing, they will go to where they will find more people that they can pull out to do that kind of free treatment for, apart from the insurance that I'm talking about.
Okay. Okay. Thank you so much, Dr. Solu. So we've heard that we have to stay close to our physicians. Like we have to just keep our ears on the ground, like for that. Okay, so let me run through these other questions. We're short on time, but Mrs. Ojo is also going to answer some of our questions. But Dr. Solu, these questions, I'll just roll them out for you, like from an expert point of view. Please, does someone who usually have mastitis during pregnancy, is somebody who usually have mastitis during pregnancy likely to have breast cancer? And then we have, if a nursing mother experiences sore breasts at the early stage of breastfeeding, does she have a higher tendency for breast cancer, given that the nipples were always sore and doesn't look perky like before? How true is it that initial cancer lump is painless? I heard that if the small lump is painful, then it is a good sign, meaning it's not cancerous. And then we have, okay. You mentioned that breast cancer can spread to other parts of the body. Is that the same for cervical cancer too? Or does it remain in the cervix? Okay. Yeah, okay. And somebody asked, why does breast cancer still keep despite surgery and chemotherapy? I think you've answered that already. Somebody has a comment here. My cousin was diagnosed to have breast lumps at 20 years old. She went through surgery to take the lumps out, but they were not malignant. She was told to start making diet changes. So yeah, that buttresses what you have told us before. So I think for another question for doctor, how long can it take for cancer to progress? Okay, you've answered that. Okay, so those are the questions for you, doctor, and I think that will wrap it up. Yeah, for Dr. Odusolu.
Okay, thank you so much. Yes, for with the aspect of mastitis, with the mastitis and breast, having soreness of breast, those ones are not risk factors for breast cancer. But that person can have another risk factor, maybe from somewhere else. You know, maybe the person, even in the history of genetics in the family, somebody has breast cancer. Doesn't mean that because you have sore nipple or you have mastitis in pregnancy or when you are breastfeeding, you have breast cancer. That's not been proven. But they never say never in medicine. We say never say never. So we cannot say that it's because they say you cannot, it's not possible. It doesn't mean that it cannot occur in that person. But it may not even be due to mastitis anyway. You understand? Because there are also other risk factors. But it has not been scientifically proved that when you have mastitis or you have soreness in the nipple, you will have breast cancer. But it can't cause it. But it has not been proven. Unlike when you have proven that genetics can cause cancer. Then also concerning about whether, like I said, breast cancer can spread. There's no cancer that cannot spread. Like I said, we have staging of cancer. All these cancers all over, any cancer of the brain, of the eyes, of the mouth, of the lungs, of the liver, kidney, bone, blood, they can spread. Once even the blood, that one is leukemia, that one is spreading all over the body. But cancers that are localized in different parts of the body, once they enter their stage 4 is called metastatic stage of cancer. It can spread to any part of the body, and it spreads through the lymph vessels and the blood moves all over the part of the body, so it can enter anywhere. But there are some cancers of some places that have predilection for different parts of the body. You know, maybe cancer of the lungs, you can say that when the person has cancer of the lung, it can easily go to the ovary, it can even easily go to the prostate. You understand? Or somebody has cancer of the breast, it can spread to the cervix. It's possible. There's nothing impossible. Cancer can spread to any part of the body. Once it is metastatic and it's spreading throughout, it has entered the blood, it can go to any part of the body.
Wow.
I think that's all the questions that you said, because I've lumped them together. Is there anyone I've not answered?
Yes, actually, one that says
just say it, I will answer it.
The one that says drugs on trial, the drug that you said is on trial in Nigeria to cure cancer, is it without chemo?
Okay. No, the drug, like I went to read about that drug. You know, I said that there's this what we call biologic therapy, targeted therapy. That drug, they call it Herceptin. That was the drug that the woman told me about, because I remember when she told me, I went to Google about the drug. What is this kind of drug that you are talking about? It's not the common drugs, chemotherapy, cytotoxic drug that I know already. So she said accepting. I said, okay, they want to use on trial, it's coming to Nigeria. Okay, no problem. I encourage her, wait for the drug to start so that I can use it. So the drug is on trial in Nigeria. It is like a form of chemotherapy. Some people say it is chemo, but it's a targeted drug towards the immune system, to deal with the cancer cells. So we can call it chemo but medically they will still say it is biologic therapy, targeted therapy, but it's a form of chemo.
Okay. Please, I would like to crave your indulgence for 7 more minutes, everyone, just to quickly run over this question. Dr. Odusolu, you omitted a question. Is the initial cancer lump is painless? I heard that if the small lump is painful, then it's a good sign, meaning not cancerous. How true is that?
Well, no. The cancer can be painful and it can be painless. Even some fibroadenomas, like I said, some fibroadenomas, some cystic, like all those benign, non-cancerous conditions I told you about. Some of them may not be painful. The person will just feel that there's a lump there. So does that mean because it is not? Does that mean that it may even be painful? Does that mean because it is painful, it is cancerous? So it may be painful, it may not be painful. It depends on the individual. But usually most cancers, they are not painful, so that maybe that's why the people are not like identical. They don't even detect on time, because if you have pain, you quickly go and see the doctor, you understand. So maybe the majority, they are not usually painful, so that it will fester for a long time, and that determines, or the pain that determines whether.
Oh, okay. I think we lost Dr. Odusolu to network. Okay, I'm sure she will come back on. So, Mrs. Ojo, let's just come back to you, Mrs. Ojo. Yes, and somebody is asking for estimate. Somebody's asking for estimate that you should tell them the estimate. And I know that we talked about this before, like when you want to think about the cost of treating cancer in Nigeria, and I'm sure even any part of the world. Hello?
Yeah, I can hear you.
So you give, please give us a perspective on viewing costs, because Dr. Odusolu also talked about the different types of costs, which you had also mentioned to me before. And
Yes.
on top of that, you can tie it in with what you're doing with your foundation to help women at various levels, because everyone, just give us 5 more minutes of your time. We need to talk about this. You can be saving a life by the little that you give. So Mrs. Ojo is going to tell us how she's supporting women, and families, not only women, and families both physically and economically, psychologically, through her foundation, because of what she has been through. So I'd like you to tie those things for us together, because I want to talk about how we're supporting you over the next 5 years, because of this.
Okay, thank you. Like Dr. Odusolu said, cancer treatment varies for different people, because the treatment plan for different patients is basically based on the exact type of cancer they have. 50 women can have breast cancer here, but in actual fact, they have 50 different diseases, right? So the treatment approach for each of the women is going to vary. Now, on the average, and based on my experience, and this is on the average, some are way higher than this, and some are a bit lower. I would say chemotherapy would cost about 70,000 naira on the average per circle. But that's only for the chemotherapy. Before you do any chemotherapy, you have to do some lab investigations for each cycle of chemotherapy. And those lab investigations include things like full blood counts, kidney function tests, liver function tests, and all of that. So those tests can cost you another 20,000. So if we say 70,000 plus 20,000 for the lab investigations, that's already 90,000. So we can just say we'll estimate it at 100,000. So estimated chemotherapy, let's say 100,000 naira per cycle, and an average patient will do 6 to 8 cycles. Radiation therapy is about 800,000, and that is exclusive of accommodation fees and transportation. So you can do the math. Surgery typically will cost about 200 to 300,000 in a government clinic. It is higher in private hospitals. And then after that, targeted therapy, hormone therapy, the cost varies, but I've given you the basic one. So now at LP Sapphire Foundation, we try to assist indigent patients, people who do not have and cannot afford this treatment, but are willing to go through treatment. So we do not always have cash, but some kind-hearted individuals donate towards our cause because they believe in what we are doing, right? So from time to time, we get the opportunity, the privilege and the opportunity to support patients who are indigent by paying for their treatment. We've paid for people's chemotherapy sessions, we have paid for their surgery, and we have never paid for radiation therapy because the cost of radiation is really huge. Now, apart from paying their bills, we render support, moral support. We really support them through the process, whatever questions they have and all of that. So basically, we support financially and otherwise. Did I answer that question? Did I answer what you wanted? I can't hear you, Buki.
Sorry, yes, you did on all fronts, and yes, and that Mrs. Ojo also said that don't allow the whole cost or the estimate to be your first focus. Like it will
That's
get
correct.
overwhelming, and then even having that moral strength, to even go emotional strength to go through may now become difficult. Miss Stella, could you post the links for the donations? Like because we're going to be partnering with Elfie Sapphire Foundation over the next 5 years to provide 500 women, with
Wow.
some form of help at a point or the other, even if it is to, get that blender or to get that first surgery done or to get post-surgery brows or to, in whatever way help can come. Do you know that $100 can actually save 4 women, for a particular period, so that's why we're saying, okay, if you'd like to partner with us and make donations for this course, like to just click on the links that we're going to be posting now. Miss Stella, please post the links for us, so that we can actually support them, and in Nigeria, no cancer cost is free. No cost for treatment is free. And so every little go a long way. I was very taken aback when she told me that there's some families that, even what to eat is difficult, and then they now receive that news. And then, some of these pictures that we saw from Dr. Bisholu could also mean that, okay, this person didn't pay enough attention because they couldn't even find enough food to eat, the right food kind of nutrition to eat. So this is kind of so very expensive. So you don't know whose life you're saving by your donations. And so I'd like us to support us, partner with us in supporting Elfie Sapphire Foundation. We're also looking at other areas where they can also be supported. So we're 10 minutes over time. I really do apologize for this. There are other things I want to make announcements for, but I won't be taking so much of your time anymore. But we're going to be sending out emails for you joining today. Thank you so much. We're going to be sending post the event summaries to you so that all the other matters we'll be talking about. Because in the coming months, we're going to be providing very unique services, products and services to women all over the world, in terms of their breast support and care. And one of those things is one of those things is, because we are all unique in our ways, being able to take care of ourselves, in those ways, in those different ways, and being able to, speak with us. Because when it comes to our breast support, not one size fits all. So we have benefits that you don't want to miss out on. But that announcement is okay. That announcement is going to come in also in the mail later on. But you know what? If you would like to make donations, just click on the links there, and also look forward to our future events. It's going to be educative as usual. You're going to see the benefits of it and the resources therein. Thank you so much for joining in. Thank you so much. Like I said, we're going to send a summary of this to your emails, and we're saying thank you so much. Thank you, Mrs. Ojo. Thank you for Dr. Dusholu for being on this with us. We appreciate you a lot. Thank you so much. Thank you. I see you, Brenda. I see you, everyone. Thank you for joining us. Thank you for joining us. God bless you.
Thank you for having us.
End of the day. Thank you.
Thank you. Bye-bye.
Thank you, ma'am. Thank you, ma'am. We lost you. We lost you at some point. We couldn't hear you anymore.
Yes.
Yeah.
Yes. It was the network.
Okay.
Okay.
Thank you.
So thank you so much for having me.
Thank you so much, Doctor.
Okay.
Yeah. Well, I'll say thank you. Yeah. Thank you, ma'am.
Thank you.
Touch. Yes, ma'am.
Thank you so much. Thank you. Thank you. Highly insightful. Thank you.
Bye.
Yeah. And if you have any questions you want to ask, any more questions you want to ask Dr. Odusolu or Mrs. Ojo, please, you can send it via email to info@thebragirl.com. We'll have all of them answered. info@thebragirl.com. Yes. And the links also will be sent to us via email so that we can, find ways of, we can have this one way of supporting Elpis Fire Foundation, because we want to bridge that gap the best we can in Nigeria for women who are going through these experiences. And like I said, we're looking at sponsoring 10 mammograms for women in Nigeria as well. In fact, I heard that there's a particular region in Nigeria where the women are more predisposed to breast cancer because of the activities that are going on around there. Well, I don't have it in a document, but some of these things is experiences that we see, and doctors report and things like that. So, but then providing this support to these people that seemingly don't have enough to take care, appreciating every little support they can get, that is what this is all about. And everything goes to Elpis Fire Foundation because we know what we are doing. Yeah, so, and also we have post-surgery bra collections for women who have gone through surgery and, are in need of that, because they are special bras made from special fabrics, so that they are comfortable post-surgery. So if you know somebody who needs that, if you need that, you can reach out to us, TheBraTalk.com, or our Instagram and do TheBraTalk of Facebook, or just email us, info@TheBraTalk.com. Every information you need will give to you, or will connect you to those information, even if you don't have them. Like I know that Mrs. Ojo also has been involved in prosthetics, for women, and she's a sure plug for all those information when we need it, and we need it right now. So she's also a mastectomy bra fitter. Those ones are also supported by some level of education, which is also scarce in Nigeria. So my point here is support at various levels is available and at your fingertip if you want them. So I want to thank you so much, everyone, for being on board with us. Dr. Dusholu, thank you so much. Mrs. Ojo, thank you so much. We will definitely speak again. Thank you.